Hi friends, back with another session here. In this session, I'll be dealing about the third subtopic under the first video, that is cornea. So let me read the points written here. So what is it trying to tell us? So it's written that the first sentence tells us the blood supply, it is avascular, and it's also written that a nerve supply, you have something known as a trigeminal nerve, the fifth cranial nerve, and under this we need to understand that there is an ophthalmic nerve, right? And it's also written three branches, like you have got a lacrimal, you got a frontal, and nasociliary, and supplies cornea. So what is it trying to tell us here? Now if you look into the structure of an eye, I have told you the outer layer has got a cornea, sclera, and the junction. So the transparent, what you see in the center, right, that is a cornea. Why? If you look into this transparent, and if you look into the blood supply of the cornea, the blood supply of the cornea is avascular, right? And if you touch it, you feel the sensation, right? And it's all because of trigeminal nerve. Now we need to understand that. So what exactly, not in so detail, but let's look into the how the trigeminal comes out. Okay, now if you observe carefully here, this is a midbrain pons medulla oblongata. We'll be dealing in detail regarding that, no issues. If you look into the pons here, where the trigeminal starts up, okay, it starts, and you can look into this. This is a trigeminal nerve, and the trigeminal nerve. So let me draw the same diagram here, and this is how it looks. Okay, this is how it comes, and we need to understand that this has got an ophthalmic nerve. Okay, it has got three branches: ophthalmic, okay, and you got an maxillary, and you got an mandibular. And if you look into the branches of an ophthalmic nerve, right, it has got three branches. The one which goes to the frontal region, the frontal nerve. You can just remember you have something known as a nasociliary nerve, and you got a lacrimal nerve. We'll be dealing in detail regarding all this nerve, but time being we need to understand that which nerve supplies the cornea. So if you observe carefully, the one which is supplying the cornea is nasociliary nerve. So this is the first thing we need to understand. So they can ask you the question, what is the nerve supply of cornea? The nerve supply of cornea is nasociliary nerve, which is a branch of ophthalmic nerve, which is the first division of mandibular nerve. Sorry, it's the first division of trigeminal nerve. Okay, so that's all you need to understand, right? So that's all you need to understand. So let us look into the points here. Since we're dealing about the sensation of an cornea, we should also understand that how do we test the corneal sensation, right? How do we test the corneal sensation? Now say example, testing corneal sensation to elicit the corneal blink reflex using cotton wisp. Okay, it's also written that touch the surface of cornea by the cotton wisp, and the patient blinks. Okay, corneal sensations are normal. Patient doesn't blink, corneal sensation are absent or reduced, that is corneal anesthesia. So let us look into the points written here. What is it trying to tell us? Now we need to look into this. We need to look into the sensation. Okay, we need to look into the sensation of an cornea here. So now let me take a cotton, okay, and touch the corneal surface. Now say example, if the patient blink, okay, if the patient blink, so that means that there is a corneal sensation, right? There is a corneal sensation is normal. So that is the reason the patient is blinking. And the next important point, we need to understand the patient doesn't blink. Now say example, you took the cotton and you touch the cornea and the patient do not blink, and we need to understand that if the patient doesn't blink, it means that the corneal sensation are absent or reduced. That is the reason the sensation of the cornea, right, and the person is not feeling. So that's the best point we need to understand, right? And now we need to understand that the corneal sensation are reduced, okay, and this is known as corneal anesthesia, right? This is known as corneal anesthesia. And what are the causes of corneal anesthesia? right? The causes of corneal anesthesia are, so the first thing we need to understand are, we have got something known as HDL acts, right? HDL acts, this is how you can just remember, okay? This is HDL, okay? You have got something, this is an HDL and this is ACTS. And what do you mean by HDL acts? That means if you look into the patient of herpes, okay? If you look into the patients of herpes, if you look into the patient of diabetes, if you look into the patient of leprosy, if you look into the patient of acoustic neuroma, if you look into the patient of contact lens, and if you look into the patient of a topical timolol, right? When the patient start using beta blockers, that is a topical, that is timolol. And if there is any surgical trauma, we need to understand that a corneal sensations are reduced, right? So that's the first best point we need to understand. The corneal sensation are reduced in these conditions. How do you remember? HDL, that is herpes, yes, along with me. HD for diabetes, yes. L for leprosy. What is A? Acoustic neuroma. What is C? C for contact lens. And what is T? T for topical lenses. And S for surgical trauma. So that's all you need to understand regarding this subtopic. In the next subtopic, we'll be dealing about the other topics, right? Chal, thank you.